there's hundreds of studies. And like, for example, prior to the Women's Health Initiative, there were studies about treating women with breast cancer with estrogen.
Whoa!
And they did better. There's 29 of them in the medical literature.
Oh, my God.
These didn't get publicized.
Hi, everyone. This is Diane Gilman, formerly the Queen of Genes, but now the proud host of my own podcast, Too Young to Be Old. I want to give you a quiz. Okay. Hot flashes, weight gain, mood swings, interrupted sleep, brittle hair, dry skin. What am I talking about? Yeah, you're right. That dreaded word, menopause. But maybe we don't have to dread it so much with a guest like Dr. David Rosensweet, who is not only the founder of the Menopause Method, which we're going to find out about immediately, but also one of the biggest names in anti-aging medicine. Welcome, Dr. Rosensweet. I'm so excited to have you.
Thank you, Diane. It's good to be here.
Yeah, well, let's start right in. What is the Menopause Method and who can benefit from it? I've got age groups. So I've got premenopause, I've got menopause to postmenopause, and I've got postmenopause girls like me. So what is the Menopause Method?
Well, every human being peaks in our ovarian and even testicular hormone output at the age 20, plus or minus a couple years.
Oh.
And then there's a decline. And these hormones are so powerful, they do so many things, that as the decline takes place, symptoms arise. And then midlife, these symptoms really accelerate.
Yeah.
The droppage is too much. And because the hormones are in your brain, they're in your bones, they're in your arteries, they're in the vagina, they're in the penis, they're just everywhere all the time. The consequences are pretty intense. And it's a good thing that they're intense because it inspires many people at midlife to go, what's going on here?
Yeah.
And many will seek out assistance with this, and it's a great time in history to seek that assistance. And if you replenish those hormones, it's wonderful. You can retain so many functions that matter so deeply to all of us.
Oh, I'm with you. And I'm one of those women that said, I love this hormone replacement. I can sleep at night. My hair can grow again. My skin is replenished. I don't have those mood swings or those hot flashes. But when I got breast cancer, and it was discovered at the age of 72, the first thing the doctor said to me was, well, you gave it to yourself. Look, you flooded your system with hormones for years and years. Well, first of all, I would like to say the doctors kept refilling the subscription. They never said, don't you think you should back off, Diane? Or, you've done this for 30 years. It's a little bit on the long side. Doctor, what do you have to say? And I believe they told me they were bioidentical, but let's just discuss, number one, how long in your life as a female can you take hormone replacement therapy? And are there still doctors giving out hormone replacement therapy that is not bioidentical? And what is bioidentical?
It's about 15 questions in there. I counted them.
Yeah, but you can handle it.
I can handle it. For one thing, the doctors were writing those prescriptions and had been doing so for decades and decades and decades because the benefits of replenishing hormones were so great. And then the oddest thing that ever occurred in my career, in 2002, a study came out that scared the doctors and scared women. And the study was falsely reported, but the cat was out of the bag. And what it declared was, well, you have to look into the details. Women who were on Premarin, which is estrogens derived from horse urine.
That was me for a while.
And it's good stuff. It's not my favorite stuff, but it did a lot of good for a lot of people. They had a reduced risk for breast cancer. That was in the study. Women on Premarin alone had a reduced risk in the study. Why the study blew up is someone misinterpreted it.
Oh, no.
And what they said was there was an increased risk with Prempro, but what they also said in the study was it was statistically insignificant, which in medicine means don't pay any attention to it.
Yeah.
And in 2017, the study was retracted by the original study committee. They said after 18 years of follow-up, there is no increased risk of breast cancer, heart attack, and stroke. Millions and millions of people around the world heard the false reporting. And very few people have heard. So what I'd like to do, Diane, since this isn't such an important topic, I'd like to give you my version of the science of this.
Yeah, and before you do, I just want to say to the audience that I went to one of the top recognized cancer doctors, surgeons in America, and the first words to me were, well, of course you have breast cancer. You flooded your system with hormones for way too many years. That was Dr. 2017.
Yeah. Well, I want to offer a different opinion.
Yay.
And by the way, your audience can download a free copy PDF of my book, and in chapter 3 I discuss this in detail. It's about risk, and there's a Bible out there on risk written by an oncologist who specialized in breast cancer. His name is Avram Blooming. The name of the book is Estrogen Matters. And what I recommend to every single woman that we treat who's had breast cancer, that they read that book, because there's the real compendium of the science. But I'd like to summarize the science for your audience.
Please.
Excuse me. We're all at risk for thousands of diagnoses. And we're all at risk for hundreds of cancers. And as a male, I happen to have an increased relative risk for prostate cancer. That wasn't always this way, but it is these days. And women happen to have an increased relative risk for breast cancer. Wasn't that way when I was in medical school, but is so now. Given that we're all at risk, here's the science. Women who are treated with hormones are at less risk for breast cancer, heart attack, and stroke than women who are untreated.
Now, may I ask you I'm going to insert a question. You can answer it afterwards, but I was given, as are younger women, given tamoxifen. I was given a version of tamoxifen after my double mastectomy, after my chemo, after my radiation, and was told this was going to protect me. The fact that it would leach every bit of estrogen out of my body was my only insurance policy to living longer. I couldn't tolerate it. It really had terrible side effects for me, and I'm pretty tolerant. So it's so confusing.
I think the science is worth repeating.
Repeat it.
There are causes of cancer, and there's a long list of them. And we're all at risk for cancer, but here's the science that women who are treated with hormones are at less risk for breast cancer, heart attack, and stroke than women who are not. And here's another interesting piece of science. Women who've had breast cancer and have had that breast cancer properly treated are at a risk of recurrent the rate is a little higher than a woman is for getting cancer in the beginning. The rate of recurrence is a little higher. But she's at reduced risk for recurrence if she's treated with hormones than if she's not.
Wow.
That's the science. And for someone to really, who wants the in-depth view of this, they need to read Dr. Blooming's book, Estrogen Matters. He goes into this with great depth. It doesn't absolve us from risk, but men who are on hormones are at less risk for prostate cancer. Women who are on hormones are at less risk for breast cancer.
Now, here's what I find, and it's fascinating for me to do this podcast. Because when you've lived as long as I have, and I'm 78 going on 79, you've had a few issues along the way. But they said to me when I was getting the treatment, we are still following the golden rule of it's chemotherapy and da-da-da, and then afterwards it's drugs that leach all of the hormones out of your system, and that's your insurance policy. What I find from doing any kind of podcast on medical is that there's a yin and a yang, a yes and a no, and it is so confusing to me as a layman. So I'm listening to you and I'm thinking, oh, yes, 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 yes. I want those hormones again. I felt so much better. I slept at night. My whole skeletal system wasn't aching. I mean, it had huge benefits and energy. As a matter of fact, I remember Suzanne Summers saying, I don't want to live without hormones. I need the energy. I want to live a super active life. Okay. So now I'm listening to you and I'm thinking, yeah, I want to go on hormone therapy again. And then I go to my oncologist who says, what? Are you out of your mind? And they may be operating. It is so clunky, a medical system. It has to do with the hospital you're affiliated with, what their beliefs are, what they want to push. And so I hear these two different points of view. I would love to start bioidentical again, but I'm scared. And yet you're telling me that actually, realistically, it's a better way to go. So do me a favor. Can you explain to everybody, including me, what is the difference between hormones, like estrogen, and bioidentical hormones, and why you believe they're safer?
Well, I didn't make a declaration that they were safer.
Oh, whoops. Okay.
But I would like to answer the question, which is an excellent one. Human beings have tried to replenish hormones for over 1,000 years. The Chinese collected the urine of young women and young men and dried it out because there's hormones in there, and they fed it to the aristocracy. This has been known for a long time. Now, those were bioidentical. They were the same molecule that were produced in the young people's body. And then this is actually the pharmaceutical industry made an attempt to repeat this in, I think it was about the 1930s. They collected the urine of pregnant women, but it wasn't practical. So they then started collecting the urine of horses, large animal, a lot of urine, because the hormones are in there. Now, those aren't bioidentical because the horse has 50% of what the horse has, females don't have, and 50% they do. And then in the early 80s, independently, a medical doctor knew that there was pure molecule same hormones out there, that they had developed these for the birth control pill. Like in the birth control pill, there's a hormone called estradiol.
Yes. Yeah.
It's been changed. Well, estradiol happens to be the most potent hormone that comes out of a woman's ovary, the most potent estrogen. And Dr. Wright, really, who gave us a great gift, he reached out to a compounding pharmacist These are pharmacists who really love to get into the weeds in pharmacy and find stuff and mix stuff up. And he said, can you find that pure estradiol and pure testosterone? We think it's out there. And they did. And they actually purchased it from pharmaceutical manufacturers who were producing it. They weren't using it in its pure form. They changed the estradiol to ethinyl estradiol, for example, for the birth control pill. But they sold the pure stuff to the pharmacists who just put it up in creams and gels.
Yeah, I took a cream. You're right. Yep.
And it's the same molecule that's in the human female, or we also have same molecule for men, same one that comes out of the testicle. That's what bioidentical means, same molecule.
Why is it safer? Or
Well,
why is
again,
it portrayed as safer?
I mean, and I don't know who's portraying it as safer. It's a little risky to portray it as safer. There are some studies that suggest it's safer, but you know, when you go into the world of medical studies, there's the good, there's the great, there's the magnificent, and there's the garbage.
Yeah.
And there's decent studies about the safety and efficacy, but really there needs to be long-term studies. But to me, as a doctor, I was looking at, I want to replenish hormones for women. They sure want them. And am I going to choose a horse urine-derived estrogen? Or when I have access to the same molecule that ultimately comes from plants, by the way, which one do I want to choose? It's an intuitive thing. I said, why not copy nature? Why not do the same molecule? They were available when I started out, so that's what I chose. In the world of hormones, if you have a good doctor, a good nurse practitioner, a good PA that cares about replenishing hormones, and they've done some studying, because you have to, you're going to get decent treatment. And there's a wide variety of choices. So I leave it up to you, the consumer. There's a lot of choices. Which one resonates with what matters to you?
It resonates to me that I feel my life and how busy I am and how much I wish to achieve in this chapter of my life are deeply thwarted by not having hormones in my system. But I sit here and listen to you, and then I would go to my hospital and my oncologist, and they would say, "Oh, no, 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 no,
Yeah,
no, no.
the
You've got to
word
go
is
the
not.
opposite direction." This is the conundrum, I believe, for women today. Two things I believe are the conundrum. Number one third of us, minimum as females, but that's going up. 1/3 of us are going to get breast cancer within our lifetimes. And we're going to, okay, these are the stats I got from Mount Sinai Hospital in Manhattan. And those women are going to be told by a doctor, you're going to need chemo, you're going to need radiation, you're going to need an operation, lumpectomy or mastectomy or whatever. And then we're going to put you on what I call a horror drug, like tamoxifen. And that's where you're going to stay the rest of your life. You're going to be on an anti-hormone that blocks everything that's natural to your body. I don't know one woman who took tamoxifen or what I took, which was exestamine or whatever it was, all these names, who didn't say it was hell. And yet, that's what my medical people are saying to me. Now, I don't always listen to medical people, which is why I got cancer to begin with, from putting off testing forever. But it is so, I think, ripping apart women today. They fear all those hormonal changes. Then if you do get breast cancer, it comes down to, okay, here's a solution. No hormones, minus hormones. Yeah. And I don't think living with minus hormones is a natural way to live. Do you? I'm not enjoying it. I'm not.
Well, the publicity around the false reporting of the study was so enormous, and the recanting of that has been a slow trickle. So caring doctors, they're still living under the belief that they cause cancer or put a woman at risk. They haven't received the information, and it's not their specialty. You know, oncologists are great at oncology. They're not necessarily really invested in health and menopause and replenishing hormones, and they have not received the recanting. They haven't received the information. There are people out there who are publicizing the retraction of that study. The original study committee said, gosh, after 18 years of follow-up, there is no increased risk of cancer, heart attack, or stroke. That's in the study, same journal. Hardly any physician has heard that. There are physicians out there lecturing, going to hospitals, trying to get this back, get us back on track, but they're just begun doing this. And so it's not a surprise that your oncologist, who's not going to want to hurt you and was poisoned by some false information, it's not surprising that they tell you what they tell you.
So would it be advantageous for the medical community and certainly for the pharmaceutical community as well if a new study was done and that was proven and that study went out purely as, yay, you can take hormones, they're not going to kill you? Wouldn't that be the way to go in the medical community?
Our team is interested in doing this, and we've set up the technology to do it. And yet there's hundreds of studies. And like, for example, prior to the Women's Health Initiative, there were studies about treating women with breast cancer with estrogen.
Whoa!
And they did better. There's 29 of them in the medical literature.
Oh my God.
These didn't get publicized. I was talking with a very brilliant colleague, Dr. Berkson, this morning, and she was reviewing the 29 studies. This is prior to the 2002 study. The studies are there. And part of the problem is cancer has causes.
Yeah.
And a lot of them. And the focus, in my opinion, needs to be turned on to what in the heck is causing such an epidemic of all kinds of cancers. For your audience, I happen to have different information about the risk factor there. It's 1 in 12 women in their lifetime are going to get cancer. It's just different information. So I don't want to, 1 in 3, that would spread a certain amount of, so I politely and kindly challenge you on that figure.
It's not my figure. That was given to me, and it scared me, and it comforted me at the same time, thinking, okay, I've got a sisterhood out here, a bigger sisterhood. It made me feel terrible when they said, Diane, you flooded your system with hormones. Now,
yeah,
go ahead.
Well, you know, just to circle back, the physicians got scared and they came up with an explanation. But here's the science. Once again, even in that study, women who are on Premarin, horse urine-derived estrogen, were shown in 2002 in that study that they had less risk for breast cancer than women who were not treated with Premarin.
Wow.
Less.
It's right in
the study.
Crazy. Yeah.
And the
What is it?
only increased risk was statistically insignificant. It was 1.26, which is not significant. And they said that in the study, but that was overlooked. The press got a hold of the word increased risk. By 2006, 4 years later, they continued to follow the women. That increased risk of 1.26 went down to 1, which means no risk.
You know, I
But that
think
was
my
not
life,
announced. That was not, no doctors heard that unless you were a doctor like me I was specializing in this. I really wanted to follow what was going on there.
I think that female hormones, just because I took them for so long into my life, they really improved my life in almost every
Exactly.
way. I think I had better cognition. I certainly had tons more energy. I certainly could sleep at night. I mean, it goes on and on. So, would you say for somebody like me that went through breast cancer, Diane, seriously explore taking bioidenticals again? Find a doctor who supports it in my hometown, New York City. Would you say that to me with confidence?
Well, here's
That
what I always individualize.
okay,
I always sit down with each individual patient. And if a woman has concern, rather than give a recommendation, I give a different recommendation.
which is
I promise you that if you do some exploration, this will be solved in your own mind. And you'll come to a conclusion that hormones are not for me. I've looked into it, it's not for me. Or the conclusion will be, wow, I was scared of them, but once I looked into the details, I realize I'm at risk for recurrence. But when I look in the details, the scientific details, I think they are for me. So you get to know in your heart what's right for you. And the book, my book and the Estrogen Matters book are the cornerstone to you getting, if you can wait, it's a lot of details in Estrogen Matters. But you get to see that, well, here's another thing about Dr. Blooming. He is an oncologist. He specialized in breast cancer. And his own wife and daughter had breast cancer, and he treated them with hormones. They're on hormones.
okay. That kind of says it all. I want to ask though, it's just something that I don't understand. And a brief answer. I always get the implication that if you're getting bioidentical, it's safer than getting pure hormones. But not being
Well,
a scientist.
I think that better work can be done with the individualization of each individual woman with the tools that bioidentical offer.
Okay.
Like, for example, I can write a prescription for one woman that has this much estradiol in it and also has estriol in it, which
Uh-huh.
relates to cancer protection. Whereas another woman, she may need this much. And then the testosterone and the progesterone. With bioidenticals, I can write precision prescriptions that eventually were going after the individual woman's needs and balance. So the opportunity there to individualize, which I think is imperative in medicine,
Yeah.
that's present with
And
the bioidenticals, with the
not
compounded bioidenticals. And yeah, you look at what's possible in the world of hormones. And like I say, if you got a good provider who really cares about this and really has done their homework, they're going to do a good job with lots of different choices.
so how would and whether you're in a gigantic metropolis like me, where frankly, honestly, going for medical, there's very little individualization. There's huge. I just went to get gel shots in my knee. So I walk in, blah, 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 problems with Medicare, blah, blah, blah. I get into the dressing room. I have to wait an hour. I come out, there are 4 gigantic lines from the reception desk to the elevators and winding around. And, the doctor comes in and says, "Oh, hi, Diane. You here for a shot? Okay, I've got 12 minutes. They don't ever tell you anything.
Well,
So
there is
how would I
options,
look
Diane.
for
One thing
a
is
gynecologist that is
take
going
a
to...
look at my book.
Okay.
And contact our organization. I spend all my professional time training and
Good
mentoring.
idea.
And there are providers that we've trained in Manhattan.
Fantastic.
And the one I'm thinking of is very good. She's really knowledgeable about it. And, you can go into any compounding pharmacist in the United States and say, you're filling the prescriptions for these doctors who are prescribing. Who would you recommend?
Yeah, it doesn't. You're not going to go into a CVS pharmacy in Manhattan.
No, I didn't say
and get
CVS.
that answer.
I said a compounding pharmacy.
Oh, I don't even know what a compounding pharmacy
You can just go on the
is.
internet and say, "Where's a compounding pharmacist in Manhattan?"
Here is the point. As the population grows, individualization of care kind of decreases. One reason why I liked going to Dubin Breast Cancer Center in Mount Sinai was it was a very small drop-in clinic with as individualized care as you could get. When my husband, 27 years ago, had cancer, he was at Sloan Kettering. Not saying it's not a great hospital, but it was very much you were almost a number. And I've heard that again and again, that it isn't that one-on-one feeling. I knew I needed that to survive. So here I'm going to sum it up. Ladies, you may be in a small town, a mid-sized town, a major city like Chicago, New York, LA. There are so many different points of view. I really recommend buying Dr. Rosensweet's book and turning around and looking at the people that may be the kind of medical assistance and advice that you would like to be headed towards. I can only tell you, full disclaimer, not telling anybody to do anything, that for me, I hear the siren song of hormones, and it was a better life with hormones, an easier life than without. So you have really illuminated one thing, doctor, which is you can make educated choices if you just know where to go to read from educated people. I even got so crazy with aftercare after breast cancer that I won't even eat tofu. I won't even use soy sauce if I go for sushi because, oh my God, it's soy breeds estrogen and that's terrible. And so, you know what? This is a podcast about education and clarification. And the one thing you taught all of us today is educate yourself and then make your choices. And that is everything. I think so many of us just blindly go to the local gyno or whoever, and whatever they say, you just nod your head and think, okay, well, they're the doctor. But it should go way beyond that today.
Can I say one more thing?
Yeah, I think you should move to Manhattan. That's what I have to say, but you go ahead.
There's good people there. It all comes down to this: go shopping.
Yeah.
If you and because there's 7,500 compounding pharmacists in the United States, There's a couple in Manhattan. They know who's prescribing. One of your friends may have found a good hormone doctor. You can find them, and our book is free. It's no charge. The PDF copy of it, they can download it from your site, and there'll be some information there that can serve them in what I consider to be good medicine.
I think that is an overall lesson to learn. And I know that when I was going through treatment, one of the most valuable things I learned, and I learned it from sitting in the waiting room, and there was another patient there that was saying, oh, they want to do this to me and that to me. And I just said, no. And I thought, no, you said no? Really? Oh, it never occurred to me. And we all need to understand that we can make choices, that they are available to us, and that you can discuss your life and what the lack of hormones are doing, and then make a decision. And me, I'm actually going to do that. I am actually going to do that. Wow, you moved my needle right there from no to, yeah, let's dip our little toe into the hormone pool and see how it goes for post breast cancer. Dr. Rosensweet, first of all, you're just a doll. You're great. I thank you so much, and this information so valuable. Thank you so, so much.
My honor, Diane.
Thank you so much for listening to Too Young to Be Old podcast. The episode may be over, but the fun doesn't have to stop here. Find us on Facebook, Instagram, TikTok, and YouTube at The Diane Gilman, or visit our website, thedianegilman.com. If you like the show, leave us a rating or a review, and subscribe so you don't miss the next episode. And until then, don't forget, age is just a number. Together, we'll prove that we are all too young to be old.